So in this video, we're going to talk about how to finish and polish the Class 2 composite. And I want to show you my system that I've developed over the years. And this starts with the removal of flash with a number 12 blade or a posterior gold knife or curette. And this can be for the proximal or any other area you see. We'll then move into a finishing step, which would be to contour the proximal. And I like using OptiDiscs from the plum colored to the lemon colored. Follow this with removal of occlusal flash and refinement of the anatomy with a series of carbide burrs, or you could use fine diamonds, 7404, 7102, and 7901. We can then move into pre-polishing with Diacomp cups and points and create a high luster with the Diacomp feather lights, and this is the green and gray color. Finally, remove the rubber dam and adjust maximum inoccupable position and excursives with the patient seated upright in the chair, the 7404, cups and points, and followed by feather lights. The finishing blades, the KN1106, the SN1376, and a number 12 surgical scalpel are phenomenal. Finishing carbides, whether they be 12 fluted, 18, or 30 fluted, can be very, very helpful. This is my typical assortment of finishing carbides. When it comes to discs, there are many discs out there, but my favorite for sure, because they have a soft center and they have various sizes you can choose from, are the OptiDiscs from 𝐥𝐿, although the others can be fine as well. When it comes to abrasives, there are many, many points on the market, and I've tested these thoroughly over the years. In an unpublished study, we found that the Diacomps and the Flexi Cups from Composite and Brasseler, respectively, were great. Polishing pastes are fine, and they can give you a very nice final finish, whether they be the aluminum oxide type on the left or the diamond particle type on the right. Studies have shown that the diamond particle type shown here do create a slightly smoother surface. But I choose to use the feather lights by Brasseler. These are made by several different companies now, but I particularly like the ones from Brasseler. So let's take a look at our case here that we just finished utilizing the Stevenson Composite Mastery Kit, and we utilized a lot of different instruments in this kit to create this reasonable anatomy. I think it's pretty good the way it is, but there's obviously some flash that we created on the occlusal surface and in the interproximal areas, which is quite typical when you're performing composite restorations. But all of the instruments we utilized are available from our online store. The Composite Mastery Instrument Kit has 7 instruments in it, and these are all titanium nitride coated in a blue color, which has worked out really well to keep the composite from sticking. So we're going to start with, after removal of gross flash with the blades, we're going to utilize the discs. And we like to try to use these rotating from composite to tooth structure. You can rotate them the other direction, but it tends to create a little bit of a white line at the margin at times because of the way that the particles are kind of pushed into that interface between the composite and the enamel. So we like to utilize the ultra-thin discs made by OptiDisc and use them from the coarse to the fine in sequence, utilizing the plum colored coarse one followed by the peach colored medium grit, and then finally the final two, which would be the orange and the lemon colored, which would be the fine and extra fine discs. Some people choose to use these discs in the presence of moisture, and I think that that can help to pull away some of the particles and give you the smooth, nice continuation rather than having a white line. You see we have a white line here, and this will be easily removed with a flushing of the water and final polishing utilizing our polishing sequence coming up in the next step. So don't worry about that. But do spend a little bit of time working with the disc to create really nice buccal embrasure, lingual embrasure, and occlusal embrasure. You notice that the point here of contact is quite small, but that's the nature of these typodonts. They tend to have very small pointed contacts like this, and that's not any fault of the system being used. You can see that you can actually take the disc and either brush it up against the margin like this, or at times you may even be able to push the disc against the adjacent tooth to deflect the disc into an area for finishing, and that can work really well. So you can see at this point, I think we have pretty reasonable interproximal contours, and it's time to turn our attention to the occlusal. And we did a pretty good job on the occlusal with the original placement, but there is some flash that needs to be removed, and for that we're going to utilize our carbides. And many people like to use fine diamonds for this purpose versus carbides. I think that that's perfectly acceptable. I think that they work maybe even better in the hands of some people, but over the years I've always just used the carbides with copious amounts of air spray or even water spray at times. And I use the instrument with a very light touch to try to feel any discrepancy between the tooth structure and the composite. We don't want to spend too much time using this because that's not very efficient, but also we don't want to remove a lot of enamel while we're trying to get our composite and our tooth structure on the same plane. And that's really the goal here, is how do you get the composite and tooth structure on the same plane, and that's really what it's all about. You could use electric handpiece, turn down pretty low, maybe 40,000 RPM or even lower. If you can't get the 7901 or the 7102 in position to create the fossa you want, this one here, which is this 7404, has got a little bit more of a rounded tip to it, and it can be used quite nicely to create a little bit of a V shape in the marginal ridge or remove an area that requires a little bit of a broader sort of shape to it. We're just using various different carbides here to create the effects that we want. This is a very, very light touch on a high speed with stall out speeds. I think that slow speed would also be great. Some people like to use a whitestone for this purpose too, which I think works really well as well, also. So whatever you like to use to get the composite and tooth structure flush is great. The occlusal polishing, or you could call this the pre-polish, really has to start with a lot of air spray, and you want to make sure that your tooth doesn't get heated up, or the composite doesn't get heated up with these diacomp points or cups, because it can cause the composite to heat up and pull away from the tooth structure, and then you could end up getting a white line. So the key with abrasives is to use them really cool. This is an abrasive honing tool. You can buy these on Amazon, and you might want to just search for abrasive honing tool or grinding stone sharpener or something like that. They're about $25, and they're fantastic for sharpening up your abrasives. You can sterilize those and have them chairside for all of this work. So I'm just using that to create a little bit more of a point so that I can get into the grooves and polish up those areas a little bit better. You'll never really be able to polish into the deepest groove areas. Those will always need to be left alone or perhaps rounded open if you wanted to get a true polish in there. But I like to just leave them sharp the way I created them with the Composite Mastery instrument kit, and then polish them best I can utilizing these points and cups. We're now working with the Diacomp Gray, which is the second cup in the series. And I don't really call this a polish, I call this more of a pre-polish. It's beyond finishing, but it's not quite at the stage where you would consider this a true polish. We're using the cup, and you notice that what I've done is I've used the point in the two abrasive step fashion. So I've started with the coarse one and moved on to the fine one, and then I go back to the cup and use the coarse followed by the fine. And this is one way to do it. Another way to do it would be to stay with the green on both and then move to the points on both colors. And then we're moving into the green for the feather light, followed by the gray to create the high luster. And this again could be used with copious amounts of air spray. We don't want to overheat the surface. We want to keep things nice and cool. I'm working by myself here in the laboratory, so I don't have my assistant helping me with cooling this off. So I'm kind of using a toothbrush here with a little bit of water on it to keep things cool. Obviously in the clinic on your patients, you'd be utilizing a air syringe to create the effect you want. We're now into the final step. If you wanted to use some kind of a paste, this would be the time to use it with the diacomp in position, and it could create a nice polish as well. I think that we found that it doesn't make that much of a difference to use those pastes, and we find that we can end up having a very nice final polish utilizing the brasser system as it is. So we're using a pretty high speed with a light touch to create the final polish on the composite. You can go over the interproximals, the occlusals, all areas to get a polish that looks pretty decent. So there's a pretty simple system of creating a nice final composite. I hope it's been helpful for you, and I would welcome your comments and feedback. And if you have any questions, feel free to make a comment in the section of comments on YouTube. Please visit our site for courses and dental materials. We are really growing and have been teaching students from all over the world. And it's been my great joy in life to give back from all those great mentors I've had into helping students perform better dentistry. So thank you very much for your time, and I hope you enjoyed this video.